Hi, my name is Marissa. I'm a neurological physical therapist at an outpatient setting in Salt Lake City, Utah, and I'm a certified stroke rehab specialist and vestibular competency trained. Today I'm going to be answering the question posted to the student corner. It was, what are 5 neural diagnoses and or tests you wish you'd had more experience with going into your practice? So I'm going to first just say I'm not going to address the diagnosis one. And the reason being is that as a student, even as a clinician, you are going to see things you have never even heard about in the neurological field. And you want to go into an evaluation feeling more confident in finding that person's impairments, more so than knowing exactly what their diagnosis means. You're going to have time to research that in the future and really figure out how it might affect your plan of care. But for right now, really focus on impairments. And how do we do that is by objective testing. So 5 tests that I wish I would have had more experience with and that I had to really learn more into my practice is what I'm going to dive deeper into and what I have listed on the document as well. So the first one is the Fuego-Meyer assessment of upper and lower extremity motor function after stroke. So I love doing this test now on initial evaluation because it gives you an idea of their ability to isolate muscles and isolate movements, as well as their range of motion, their pain they might be having, a general idea of sensation, and a general idea of proprioception. And the reason why it's such a good test is because once you go into watching them do their gait or balance test, you're going to have a good idea of why they might be moving or looking a certain way. You're not going to have to question it as much. You're going to know that their movement might be due to pain more than an actual inability to utilize the muscle. I think it is your best test to give you a good idea and a starting point to where that patient might be. The next one is the mini best test. So the mini best test is a condensed version of the balance evaluation system test, and it breaks balance into 4 categories. It gives you an idea of anticipatory balance, postural control, sensory orientation, and gait. I love this test when you might not be quite sure where that person is at with their balance, and you want to figure out exactly what area of balance might be leading to their issues or their falls. After doing the mini best test, you might be able to then say, hey, okay, this person has more issues in gait, so I'm going to actually do the functional gait assessment next. Or, wow, they really have more issues with sensory orientation, I'm going to go more Berg next time. I love doing this test on any neurological patient just to give me an idea, again, where their balance issues might be if I can't figure it out from their history. The next one is postural assessment scale for stroke. This is best for your low functioning or low moderate functioning stroke patients. Reason being is it's looking more at transfers and standing balance and sitting balance. This test is going to allow for a larger change the next time you test them, which is so motivating for a patient, especially those low functioning patients who really need the motivation. If you give this patient the Berg or the FGA, it might just not go well at all, and you might see very minimal change. So I love using the postural assessment scale, and I might improve and go to a harder test the next time I test them. So my 4th one is subjective measures. As a student, you definitely learn all your subjective measures, but I feel like, for me at least, the one I became most confident in was the activities balance confidence scale, which is an awesome test. But there's so many more out there that are specific to the patient and their impairments or diagnoses. I love using the dizziness handicap inventory, stroke impact scale 16, PDQ 39 for Parkinson's. There's really good tests out there, and that the patient might feel more like they can relate to, and that will give you a better idea of what's going on in their life outside of therapy. So the final one is not stroke related. It's the modified Buffalo protocol. That's the concussion treadmill test. This test is something that really has to be practiced a lot to get down, because you're taking measurements every minute. You're looking at their heart rate, their symptoms, their rated perceived exertion, and it's hard to become confident in getting all those measures every single minute, and also remembering that you need to be increasing their speed and their speed and or incline. So I love this test though because it dictates my home program if that person's issues and symptoms are related to exertion or endurance. And it's also just a great way for you to tease out if their symptoms are due to an exertion trajectory. So those are my 5 tests I wish I had more practice with. I provided links on the document so you can download those and read more about them. And then please recall that the ANPT has created EDGE outcome measures for each diagnosis, and that can be found on apta.org.